Let's imagine a very simple situation. There is somebody sick and looking for an emergency room nearby, but don't want to spend hours and hours waiting in the lines up.
So what if you knew the current average time of waiting in the hospitals nearby you?
So you head to the hospital. So now what? You stay there at the emergency room, or?
Well, what if you could track your position in the line, and you wouldn't have to stay in the emergency room. You could track your progress online, and on your smartphone, receive SMS push notifications if we have the app, and when your turn is approaching, you receive the notification.
And voila, when your turn is approaching, you go back. You didn't spend maybe there like 10, 15, 30 minutes, but not hours.
So for the technical stuff, it's easy. We just already talked with IT for Sainte-Justine, and it could be actually done by connecting to those systems they already use for tracking patients, because all hospitals already track those data for the government. So we could actually just use those data that are already there.
Hack at it. Bravo, vous avez... Mais bravo, vous avez fait ça vite!
Yeah,
FastER!
We have the demo right here.
Oh.
But yeah, we're ready for questions during it while it's run.
That's pretty cool.
Any questions?
How are you collecting the data?
Yeah. Okay, so
The data is already there. We actually spoke to IT people from Sainte-Justine, and we know that pretty much all the hospitals have pretty much the same software, and they already collect that data. All we just need to get access to that data, or in other words, we have all the hospitals, or at least most of hospitals, to be connected to one system or provide us with an API.
How precise is the data during the day?
Sorry?
How precise is the data?
What do you mean precise?
Is it early? Is it?
well, actually, I can answer that. It's pretty. It's real time.
It's real time.
Because it's the data they're using for tracking for the nurses. So it's at the minute. It's updated.
Yeah, it's real-time data, so we can actually see the actual picture, what's happening right now.
Can you incorporate some predictive analysis, or are you just using the data that's being fed to you?
Well, we could actually predict after a while of storing those statistics, but on the first version, it's mostly to get the data real time from the hospital.
But I guess they keep historical data.
Yeah, they do have that data, so we could actually use it. Yeah.
I think it's an excellent idea with the predictive aspect, because I think things like that already exist. Now it's how do you compare to them, and this last comment I think is an excellent one. And the branding also, I kind of like it. I think the name and all the images, the way it's laid out, is pretty nice.
Great.
Yep. Yeah, that already exists, but it exists, but on local hospitals. There is no centralized system where you can get access to the public.
And so the bigger point of this is you could actually select the one with the lowest waiting time, and at that point it will load balance the flow of patients.
Hospital loads.
So it would be a good thing.
Bravo, une solution absolument essentielle pour aider les temps d'urgence au Québec.
Merci beaucoup.